Most of us suffer indigestion every once in a while. But if you have chronic indigestion or heartburn, you may really be dealing with something more severe called acid reflux. There are medications on the market to help with acid reflux, but now there's a new procedure that brings relief. The Heartburn Treatment Center at Knox Community Hospital has this new technology. And joining me today is Dr. Paul Taganides and Kathy Hare, who is a registered nurse, but also a patient who's gone through this procedure. Welcome to both of you. Nice to have you here.
Thank you.
Doctor, let me start with you with an explanation of what acid reflux is compared to something like heartburn.
Heartburn is the common name used by people to refer to a disease where things come back up into your esophagus from your stomach, technically called gastroesophageal reflux disease. And over 23 million Americans are prescribed medications to control these symptoms. And unfortunately, chronic use of them leads to serious problems.
And we are showing a video of what happens, and this is this going up the esophagus, right?
Essentially what happens is there's a valve or a sphincter muscle at the end of the esophagus that is supposed to allow normal swallowing, but at the same time control things from going back up. And what you're seeing is a diagram of a schematic of that.
And how can this be dangerous other than the fact that it's uncomfortable to the patient?
Esophageal adenocarcinoma, which is a specific type of cancer of the esophagus, is the fastest growing malignancy in the Western world.
Really?
It's an epidemic proportions. The CDC has declared it an epidemic. And although we don't know exactly why, there's a lot of strong evidence to support that chronic use of these medications leads to a change in what's being refluxed. And it's what's being refluxed that causes the change that lead to cancer. So people need to be surveyed. They can't just stay on medications.
Now, there is a new procedure. We're going to talk about that in a moment. And, Kathy, you had it done. But let me ask you what led to your decision to go ahead with this procedure as opposed to just meds.
I had suffered with heartburn for the past 10 years on and off. And I had been on daily medication for the reflux for the past 3 years. And I was working with Dr. Taganides in the research trial that we did. And we followed the 12 subjects, and I wanted to see how they did with it, and they did great. So that's when I decided, okay, this procedure sounds like it would be a good thing for me to have done.
Dr. Taganides, how does it work?
Well, it's an ingenious design, really. It's a very simple thing. I have an example of it, if you wish. It's a series of...
Looks like a bracelet.
It looks like a bracelet that we then bring together, and it essentially sits on the esophagus just like that. And it allows things to expand as you swallow and then come back to position at rest. And that simple augmentation or increase of the pressure of the lower esophageal sphincter prevents reflux but allows you to swallow normally. Something that in previous times with surgeries we do called the Nissen fundoplication can have side effects that people don't like, and that scares them.
We are showing some video of exactly how it works, and it does look ingenious, actually. Is it a difficult procedure, a surgery to have done, doctor?
It's the beauty of this is that it's minimally invasive. It's completely outpatient, meaning that within a few hours of the operation you are home.
And Kathy, how do you feel?
Great.
Did you notice a difference right away?
Yes.
Really?
Yes. I went in that morning around 8:30, and I was home by 3:30. You are under general anesthesia, which makes you a little drowsy, but I didn't really experience any pain and no heartburn medicines anymore, so that's great.
I'm going to charge her double for that.
Well, apparently you know where to find her.
That's right, that's right.
So, doctor, who's a good patient? Obviously, Kathy had been on medication for 3 years, so someone like that. Anybody else? Any other standards?
The target for something like this, since it is, even though it is minimally invasive, it still is invasive. As I mentioned to you earlier, 23 million Americans suffer and are prescribed medications, but very few people are offered any other options. This is going to target people that have been on medications chronically and are unhappy. For example, they still don't find full relief or are escalating their dose monthly because they can't get relief on the standard dose, and people that have had reflux for some time. It's not going to be for someone that had an episode once or twice a week or something like that.
Right, and we've had your information on our screen so that if people want to talk to you to see if this possibly is right for them, they can get a hold of you. It's really interesting.
Absolutely.
Thank you, doctor. Pleasure to meet you. And Kathy, so glad you're feeling better.
Thank you.
For joining us.
I am too.
Thanks.
Thank you.